Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Lichen sclerosus. Lichen sclerosus is a skin condition affecting the genitals that causes white patches and itchiness. Skin changes in the genital region can be alarming, especially if you're sexually active. It mainly affects women, especially after menopause, but people of any sex and even kids can develop it as well. /r/n/r/n The cause of lichen sclerosis is unknown, although an overactive immune system may play a role. /r/n/r/n Researchers still need to gain an understanding of what can cause a flare-up of lichen sclerosis. However, it is correlated with /r/n/r/n. It's also possible that certain people have a genetic tendency toward the disease, and studies suggest that abnormal hormone levels may also play a role. Here's what it's helpful to know about this relatively uncommon skin disease that is important to treat to avoid complications. /r/n/r/n While lichen sclerosis is uncommon, it is also not rare in the older adult female population and may be underreported. Among older females seen in general gynecology offices, vulvar lichen sclerosis affects 1 in 30. Among the general population seen by dermatologists, lichen sclerosis is seen in between 1 in 300 and 1 in 1,000 individuals. /r/n/r/n Mild cases usually start as shiny white spots on the skin of the vulva in women or on the foreskin of uncircumcised men. It also sometimes affects the area around the anus. In women, it can appear on other body parts, particularly the upper torso, breasts, and arms, but this is rare. /r/n/r/n If the disease worsens, itching is the most common symptom, which in rare cases can be extreme enough to interfere with sleep and daily activities. Rubbing or scratching to relieve the itching can cause /r/n/r/n It's a good idea to avoid having sex, wearing tight clothing or tampons, riding a bike, or any other activity that might cause pressure or friction on the affected areas while you are experiencing symptoms. Any trauma, including friction, can cause fragile skin to be damaged and lead to scarring. /r/n/r/n In severe cases in women, lichen sclerosis can lead to scarring that causes the inner lips of the vulva to shrink and disappear, the clitoris to become covered with scar tissue, and the opening of the vagina to narrow. People with lichen sclerosis can sometimes experience sexual dysfunction because of these symptoms. /r/n/r/n In men with severe lichen sclerosis, the foreskin can scar, tighten, and shrink over the head of the penis, making it hard to pull back the foreskin and decreasing sensation in the tip of the penis. Occasionally, erections are painful, and the urethra, the tube through which urine flows, can become narrow or obstructed, leading to burning or pain during urination and even bleeding during intercourse. /r/n/r/n When lichen sclerosis develops around the anus, the discomfort can lead to constipation, particularly in children. /r/n/r/n Diagnosis of lichen sclerosis is usually made by medical history, report of symptoms, and physical examination. A skin biopsy, removal of tissue to analyze in the lab, is sometimes done to confirm the diagnosis and rule out skin cancer. /r/n/r/n There are a few different approaches to treating lichen sclerosis in the genitals. There are different types of medication, including systemic medication and topical medication, as well as procedures that can help clear up symptoms. /r/n/r/n Topical corticosteroids are usually the first line of defense against lichen sclerosis to cure disease and restore the skin's normal texture and strength. /r/n/r/n However, steroids won't reverse any scarring that may have already occurred. And because they're very strong, it's important to contact a healthcare provider frequently to check the skin for side effects when the medication is used daily. /r/n/r/n Once symptoms are gone and the skin has regained its strength, the medication can be used less frequently but may still be needed a few times a week to keep lichen sclerosus in remission. /r/n/r/n If the disease doesn't clear up after a few months of using a topical steroid cream or ointment, a healthcare provider may move on to prescribing a medication that modulates the immune system, such as protopic, tacrolimus, or Elidel, pimecrolimus. /r/n/r/n For people who can't tolerate other medications, retinoids may be helpful. Sometimes, too, other factors, such as low estrogen levels that cause vaginal dryness and soreness, a skin infection, or irritation or allergy to the medication, can keep symptoms from clearing up. /r/n/r/n For men whose lichen sclerosis won't clear up with medication, circumcision is almost always effective. Once the foreskin is removed, the disease usually does not recur. For women, surgery in the genital area or around the anus generally isn't recommended. /r/n/r/n Complete remission of lichen sclerosis is more likely in men. For uncomplicated cases treated early, 90% or more of men can experience full resolution of symptoms. However, it is less likely to entirely go away in women, although there can be times when the condition improves. /r/n/r/n Lichen sclerosis can have some complications beyond the discomfort of the condition, including scarring and an increased risk of skin cancer. /r/n/r/n Lichen sclerosis of the genital skin can cause scarring that can interfere with urination, sexual intercourse, or both. /r/n/r/n Lichen sclerosis has been linked to certain cancers. While it does not directly cause cancer, skin that is scarred by lichen sclerosus is more likely to develop cancer. About 1 in 20 women with untreated vulvar lichen sclerosus develop skin cancer. It's essential to get proper treatment and to see your healthcare provider every 6 to 12 months to monitor and treat any changes that might signal skin cancer. /r/n/r/n Lichen sclerosis is a skin disorder thought to be caused by a mix of hormonal and autoimmune factors. It primarily affects the skin of the genital region. The condition leads to white, scaly patches of skin which itch. In some cases, these patches of skin may be more prone to developing certain types of skin cancer. /r/n/r/n Lichen sclerosis can be treated with medications and, in extreme cases for men, circumcision. If you are concerned about your skin health or have symptoms, see a healthcare professional. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.